Good morning and welcome to the CABE webinar for Wednesday the 27th of May. Today we're looking at the need to be inclusive with Sarah Sorrell. My name is Jordan and I will be the moderator for today's session. I'm the Regional Services Administrator here at CABE, so please send through any queries that you might have related to that. We'd like to make our webinars interactive, so we do encourage you to send through any questions. You can do that using the control panel on the side of your screen or via YouTube. And if you would like to use Twitter, you can use the hashtag CABECPD. So this morning's speaker is Sarah Sorrell. Having been a property surveyor for over 20 years, Sarah took the decision this January to bite the bullet and set up her own surveying and access consultancy. She started many years ago as an architectural technician after undertaking design qualifications and then went on to gain a Bachelor Honours in building surveying. Sarah's roles over the years have increasingly seen her working with adults with disabilities, most recently as a regional property surveyor with MinCap. Over the years, Sarah has developed a real passion for creating inclusive environments through design and refurbishment. And now in her own business, she undertakes access audits and advises clients on how they can make positive changes to be more inclusive. Her clients include industries such as leisure, hospitality, culture and heritage. She finds it to be varied, excited and very rewarding. Ultimately, we all need to do our bit to make society as a whole more accessible. It can be argued that people are not disabled by their medical condition, but by structures and attitudes in society. Therefore, we have chance to remove these barriers. Sarah firmly believes that inclusive design can be both functional and practical, but also beautiful. Her webinar session this morning is going to provide information on the Equality Act 2010 and the design guidance documents available, but as also handy tips and advice about the small changes you can make to your business and simple ideas to implement when designing. So if you give me a couple of seconds, I will just hand over to Sarah and she will take you through the session this morning.
Good morning. I'm Sarah Sorrell, as Jordan's already let you know. Thank you very much for joining me. I'm really here to share my passion for inclusive design and accessibility with all of you, and I hope you'll find it interesting. As Jordan said, I want to go through a little bit about what inclusivity and accessibility is, the legislation and guidance that drives why we need to be accessible and inclusive, how it affects us as building engineers and how we can help contribute to a more inclusive society where we'll come across access issues in our day-to-day roles and how we can improve things and just be more aware. So I wanted to talk to you a little bit more about me, although Jordan's done a great job going through the bio, but I just wanted you, I always feel if someone's speaking about something, you sort of want a little bit of an idea as to why they feel they can and why they're passionate about it. So as Jordan said, I started out as an architectural technician, had a real passion for working with buildings and design. I enjoyed that very much, but in fact, when I started out, there wasn't even CAD. I was still drawing on tracing paper and scratching out with a razor blade. And then CAD came in, and I think with that addition of the computer technology, I lost my passion for it a little bit, for constantly being, I was very office bound, very CAD focused. And I took a different position and was offered the opportunity to change my qualification to building surveying. I was working in building control at the time, so I've also got a little bit of experience there with the approved documents and enforcement. And then I went and did another 3 years and converted my degree to building surveying. And I've loved my surveying role. I've found it very, very varied. In that role, I've worked in social housing. I ran a disabled facilities grant programme for quite a long time for a local authority, which was what really kick-started me with working with adults with impairments and children with disabilities. and loved it. And from that, I've worked with the Orders of St John Care Trust. I was their regional surveyor looking after care homes for quite some time in Lincolnshire and Oxfordshire, working on designs for new care homes, doing refurbishments. And again, that was all many of the adults, not just elderly, and the impairments that can come with that. I did a lot of training with the Alzheimer's Society as well, learning about dementia and how that can affect the sensory side of people, as well as some physical disabilities within the more elderly community, and designing around that for them. And also there gained an awful lot of experience about managing contractors on site, where you've got very vulnerable people still on site. And then obviously the back end of last year, with one thing and another, it was looking, there was a possibility my role was going to change greatly where I was. I've said for years and years and years that I wanted to do this and run my own company. And bizarrely, on holiday over a glass of wine with my husband, said, well, I think I can do this. I didn't just want to do the general surveying side of things. My husband actually was the one that pushed me and said, look, you need a unique selling point. You know this accessibility stuff inside out. The name of my daughter is Oakley, and hence Oakley Estates was born. I did a lot of work with the Centre of Accessible Environments and did some further training with them around access audits, so I could do that more specifically, as well as the design appraisals and other sort of advisory side of accessibility. And here I am. So I just wanted to I'm so passionate about other building engineers and surveyors and all other fields, understanding why we need to be accessible and embracing it and incorporating it in the world we work in. I find it so rewarding and so important, and that's why I'm here today to share this with you. So for me, I think the key thing is understanding what drives accessibility in society. It's not just about legislation, it's why do people want to be accessible? Why should we do it? I like to think that human desire just makes us want to help each other and help people live the most fulfilled life that they can live, doing what we do. We create spaces for people to live in and work in, and I hope it's just human nature and passion that wants us to make those spaces accessible to everybody. So yes, I've said here, social inclusivity is driven by the desire to empower all the marginalised and discriminated people by giving a helping hand to everybody who's dealing with any kind of physical or mental disability. And for me, that's not necessarily just the physical building. We can, within our businesses, we can look at how our policies are written, our ethos, our attitude, everything about what we do. There has very much been a positive shift, I think, in society. We work much more, there's very different models now of how we look at disability. I think very much, perhaps people used to think about the medical model, which sort of the attitude of the medical model is that the person is disabled and that the solution to that is to cure them, give them medication, fix them almost. Whereas now I think we look very much more to the social model. And the social model looks as the picture here, that actually the issue is the barriers in life. The disability is caused by the way society is organised, not by the person's impairment, which is a much more positive way of looking at it. And I think generally across the board, there's been a really positive shift in how we see disabilities and impairments. There's actually, there's over 13 million people. I mean, that was taken from a family survey back in 2017, but at that point there were 13.9 million people in the country reported with a disability. The government is fully committed to supporting us creating an inclusive society. That's come in the form of planning policies and strategies, very much a focus on the needs of the disabled people being considered as an integral part of development process, ensuring that we've got, through planning system, we've got sustainable communities and mixed and inclusive environments, very much making sure there's early consultation and that we're looking at the communities and the diversity of those communities when we're considering any development. And also, I think another thing that drives this, the cold hard reality, is increased turnover, particularly for hospitality and leisure. If you're a hotel, for example, that doesn't have accessible communal spaces, accessible bedrooms, you can't open yourself up. the purple pound, as we call it, for people with disabilities is massive. It's £1 billion industry. So as much as I don't like to think about the whole hard cash side of it, I think it is another factor. Obviously, if you make your business accessible to everybody, then you can increase your turnover. And also, obviously, the side effect of not meeting with regulations and acts in places, you open yourself up to potential litigation and negative press for your business. Recently, I was watching something on the news about a local university. A student couldn't get into the lecture theatres and had gone straight to the local news. And I sat there that night thinking, this is the absolute consequence of spaces being designed and not adapted. Significant negative press for the organisation. So obviously then we're going to move on to what drives accessibility legislatively. The Equality Act 2010, I'm going to talk about this on a separate slide in a little bit more detail. This is a unifying piece of legislation that superseded lots of other smaller pieces. I think there were 116 smaller pieces of legislation. And there's now 9 protected characteristics within that. Obviously, other legislation, you've got the building regulations, which are the main standard set for design and construction and alterations of properties. It's developed by government and approved by Parliament. These regulations are, again, another avenue where the government can ensure that we're constantly increasing our standards and making buildings more accessible. I think Part M is currently out for consultation, and changes will be made there. And I think that's something, again, where improvements to how accessible buildings are and the standards we have to build to will improve all the time. Planning, we've already discussed, national and local policy. Lots of local authorities are building in conditions now to planning applications that there has to be accessible elements within a development. Looking at housing itself, there was another article in the Cave magazine I noticed last month. Many properties with a front step. Obviously, we're moving away from that now, and a lot of these things will be as a planning condition, design and access statements that we have to put together to show how we're meeting with that and continuing to promote inclusive societies. There's also a public sector equality duty. This is something published by the Equality and Human Rights Commission for public sector organisations, giving them a legal duty to ensure that disabled people are treated equally. It's designed really to prevent and reduce institutional discrimination. It concerns over 40,000 public sector bodies in England, such as central and local government, hospitals, CPS. It would cover highways and pavements, for example. We're looking at people with visual impairments as well, how pavement schemes are designed. It looks at housing strategy and allocation. Is that being done in an accessible way? Licensing. So it really, that public sector duty actually seeks to advance equality of opportunity within the public sector, eliminate discrimination and harassment, promote positive attitudes. So again, all these things are here to be a positive influence. So the Equality Act itself can be a little bit confusing. It's a bit of a beast in that there's certain areas where it applies differently to certain organisations. The protected characteristics we've got here: age, disability, gender identity, marriage, civil partnership, pregnancy, race, religion, sexual orientation. The overriding principle of the Act is that everybody is treated equally. So here it would say treat a woman as favourably as a man. There are provisions relating specifically to disability where we talk about making reasonable adjustments for people with a disability. The Act requires that service providers, so that's those selling land and property, employers, education providers and transport providers should not discriminate against disabled people. We'll talk a bit later about what reasonable adjustments are. So this document legally protects people from discrimination in the workplace and in wider society. When we talk about discrimination, the discrimination that's prohibited is what we call direct discrimination. So that's treating somebody differently and less favourably because of one of the protected characteristics. we talk about indirect discrimination. So this would be treating somebody the same as everybody else, but by doing so, it has a negative effect on them. There's discrimination by association. So the person doesn't necessarily have the characteristic themselves, but they are associated with somebody that does, and then they receive discrimination or feel they're being victimized or harassed in any way because of that. Discrimination arising from a disability, so somebody being treated unfavorably, not because of the disability themselves, but because of something connected with that disability. And then we also have harassment and victimization. So if somebody feels they're being victimized or treated differently because of any of the protected characteristics, or persistently harassed. So that's what the Act is there to prevent, somebody feeling any of those things or experience any of those things. The Act, as I said, there was 116 pieces, I believe, of legislation: Sexual Discrimination Act 1975, Race Relations Act 76, the DDA, obviously 1995, employment regulation. There was all sorts of things that was all very different and actually quite complicated to understand, and quite complicated for people to bring any sort of claim under all those separate acts. So the idea was that it was replaced, making it easier to understand, and in some cases strengthening the protection that was given. There's been various updates, characteristics added in. There's been an update to protect breastfeeding. In 2011, there was some retirement changes so that you're not forced to retire at the age of 65. So that sort of abolition of that obligation. So under the Act, what is a disability? A disabled person is a person with a physical or mental impairment that has a substantial and long-term effect, an adverse effect on their ability to carry out normal day-to-day activities. So we're not necessarily talking about short-term things that affect you. Substantial is defined as more than minor or trivial. And long-term is defined as having lasted or being likely to last for at least 12 months. So there are some temporary conditions, certain cancers and the way people are affected by some short-term conditions. If that's likely to be for at least 12 months, for that period of time, they will be protected by the Act. As I've said, it's estimated there are about 13.9 million people disabled as defined by the Act. I always think it's very interesting when I've done sort of training and things before and ask people, what's the first thing that comes into your head when you think disability? Most people say wheelchair or ramp. And I find that quite interesting, because only 8% of people with a disability are in a wheelchair. There's so many other disabilities and so many hidden disabilities, people that have mobility problems but aren't in a wheelchair. So I think there's still very fixed views when we say disabled as to what people see, and I think there has historically been perhaps people, oh, we've put a ramp at the front and all the doors are wide, and you feel like you've ticked a box, and it's so much more than that, and there's so much more we can do to make sure spaces are accessible to absolutely everybody. So if we move on to talk about types of disability, I could have filled this slide about 3 times over. Obviously there's people with hearing, and communication sort of comes together. People with communication would be people with stammers, people that in any way struggle to communicate through mental issues, speech impediments, cognitive, again with dementia, learning difficulties, visual impairments. And again, it's quite alarming. I think I read somewhere that over 90% of people with visual impairment aren't actually blind. There's so many aspects to visual: losing peripheral vision, colour blindness, only seeing in black and white. It's not, I've actually worked on a scheme where somebody said, well, why are we worrying about all these colour contrasts and things? Because the person can't see, because they just assumed that if they are blind or registered blind or have a visual impairment, they can't see. And that's in 90% of the case, over 90% not true. There's a big push at the moment for making sure places are accessible to people with what we call neurodiversity. That covers a range of issues from dyspraxia, dyslexia, Tourette's, autism, development, language, ADHD. There's so many conditions that come under that that affect so many different parts of society, schools, just generally something that is becoming more and more prevalent, I'm finding, in training and sessions that I'm doing. Dexterity and mobility, again, this is where sometimes we perhaps think about, oh, you know, somebody can't walk, they're in a wheelchair. Well, often somebody may find steps easier than a ramp if they've got certain mobility problems. Dexterity, even things like flushing a toilet, if there's often, I find in accessible toilets, there'll be a big push button on the back wall. If you've got problems with your hands, you probably can't push that button. So there's many things with dexterity that we don't think about. Emotional impairments, mental health problems. Lots of people find certain situations very challenging, noisy spaces, acoustic spaces. And when we look at learning disabilities, we think about quiet spaces for people as well. Often in, I've just done an access audit of a museum, and one of the things we've built into that is making sure that they have a quiet space so that people can retreat if they feel overwhelmed. And removing, for someone to have somewhere to go to remove that moment of anxiety can be invaluable, and it means they can continue to enjoy their experience of visiting wherever they're visiting. Hidden disabilities we talk about, such as brain injury, things on there, HIV, diabetes, epilepsy, fibromyalgia. There's many, many conditions, rheumatoid arthritis, that can significantly affect somebody's lifestyle and way of life and how they experience things for longer than the 12 months that we talk about. So with all these disabilities and impairments under the Act, certain sectors have a responsibility to make reasonable adjustments. Employers, shop owners, local authorities, schools, many organisations must take positive steps to remove barriers faced by people with disability. What's reasonable? This is always tricky. It depends on the type of service being provided, particularly where we're looking at altering something that is existing. We look at the cost of that adjustment, the availability of funds, how effective that alteration is going to be, the potential benefit, the resources, practicality, the extent of disruption as well, particularly where we're doing refurbishments. Have any adjustments already been made? Has there already been any attempt to make alterations? So where does the duty apply? So the duty to make reasonable adjustments. Duty holders must make the reasonable adjustments where disabled customers or employees would otherwise be at a substantial disadvantage compared to disabled people. And it does say in the Act, which I would like to hope doesn't need saying, but you cannot charge the disabled person for making that adjustment. Adjustments are expected to be made, so it's to avoid the disadvantage caused by the way something is done. So we also talk about provision, criterion, or practice. That's the how, really. That looks at your policies, procedures, how you deliver something. I have been involved in access audits where we've looked extensively at making physical alterations, and we've not been able to for various reasons, or it's not been deemed reasonable. But we have changed the way a service has been delivered, and that's had a really positive impact on the way people access the business concerned at the time. So there are other things you can do. It doesn't always necessarily have to be about the physical alteration of a building. And obviously avoid the disadvantage caused by a physical feature. And the other thing we can discuss is providing auxiliary aids and services. And this is another thing we can think about retrofitting, but also important to think about at design stage. What can we build into premises as an addition? I mean, the old-fashioned thing is always hearing loops, but there's so many auxiliary aids now. And certain things we don't always think about, particularly for people with visual impairments, people with cognitive impairments that easily feel anxious. We can look at the lighting schemes at design stage as well. Lighting can have a huge impact on how people see a space and how comfortable they feel in that space. So there's lots we can do to make sure that we've done reasonable adjustments to existing buildings and also to new buildings. So for me, what's really important is how can we as building engineers contribute to this inclusive society that we're all striving to achieve. And I had a little think about this, and I just put some things on a slide that sort of thinking, what do we all do? What are we all? We're designers, structural engineers, building control officers, all sorts of walks of life. So I think really what we can do, we're all involved so extensively, from designing and including. And I think as designers, the key thing is just to promote, encourage, initiate. Think about this all the time when you're looking at a design. Who's going to access the space? How the whole life of that space as well, particularly with housing. As a, we want sustainable communities when we're designing. We want people to feel that as they get older, they're not suddenly, what hasn't been a barrier in their home isn't going to become a barrier. Your own personal attitude, thinking about this, feeling really positive about this. We really have a chance to promote accessibility just in our day-to-day roles, our lives. As an access auditor, I find I'm always looking at things. Whenever I go to hotels, the amount of times I've been to reception and asked if I can have a business card for somebody, or just asked, or excuse me, could you tell me where the accessible toilet is, because it's not immediately obvious or there's no signage. And I find I'm always looking for ways to get involved and try and make an improvement. Your own business, many of us, I don't have business premises. When I set up, I do have a website that I created myself that I've looked at recently and just think, oh dear. So I've now employed somebody to look at that for me. And part of that is for me as well, making sure that that's accessible. Do you offer an easy read option, colour backgrounds of websites as well? Some people want to see that website with different colour contrast to the background. If you do have business premises, making sure they're accessible, thinking about when you invite people in for meetings, how that's done. If you're providing a report to somebody who's got a learning difficulty, or how you present that report, are there different ways of doing it to make it more accessible for them? So there's so much you can do in your own business as well to make sure that you're accessible to everybody. And as we talked about on an earlier slide, as much as that's brilliant, it can also increase footfall. What I do tend to find is people that do have a disability or an impairment, once they find a company or a place or a service that meets their need, that they trust, they're very loyal to it. Enforcing regulations, again, I've worked in building control previously. It's something with, particularly for disability, approved document MK with stairs, enforcing the regulations, making sure whenever you're out there, you're actively seeking to make sure everything is done in a compliant manner, getting involved when there's anything up for consultation, sharing ideas. Many of us, will have an idea, will have witnessed something that didn't work in a previous scheme. Use that when you're designing, think, oh, again, I go to NAIDEX actually at the NEC, which is quite a medical event, but it looks at new shower system, everything you can imagine that you'd possibly want in a built, specialist baths. I always try to keep myself up to date with technology, so that again, we've got that when we're designing a space, you can think, oh, I saw that actually would really work in this situation. So share ideas and keep up to date with things that might help an inclusive environment. Assessing quality, so snagging. If we see something, it's expensive often if we've got something wrong on site with regard to accessibility, but don't turn a blind eye to things. Make sure that we're checking the quality all the time and auditing. And that doesn't necessarily mean I undertake access audits as an access consultant. It's a specific task that I do, but even in your own business, you can audit, or even at the end of a scheme, you can reflect back and think, how has that gone? What can I learn from that? Or get involved and have a look at. It's great fun undertaking access audits. It's another string to your bow, and I particularly really enjoy it. So the Act and us and the people we design for. Everyone we come into contact with potentially will be protected by the Act. Service providers have duties, and when we talk about service providers, it's likely we either work for one, we are one, or we're acting on behalf of one, be it designing for public sector, banks, shops, businesses, local authorities, NHS, schools. In everything we do, the organisation we work for or are acting on behalf of are likely to fall fall within this. The Act varies the obligations vary in the Act. So service providers, I say, and we talk about the private sector, your banks, your shops, your public sector, local authorities, NHS, voluntary, again, community halls, even charities. There's an anticipatory need for those organisations. So where a disabled person's put at a substantial disadvantage by a physical feature, the service provider can make physical adjustments. So that's talking about physically altering the building, or we can seek to alter the service, which we talked about before, in a different way. So looking at your policies, how you deliver things. That duty is anticipatory. So you have to assume that somebody with a disability is going to come into the organisation you work for, or if you're designing for one of those organisations, you have to anticipate that will happen. For employers, the duty is reactive. So as an employer, if you're not currently employing anybody with a disability or impairment, then you don't need to make those changes. I always think in some way that's a shame, and I think we need to ensure when we're advertising positions within our companies that we make job adverts particularly accessible to all walks of life, and that we encourage people with disabilities to feel they can get involved. But that duty is reactive. Schools are an interesting one. Schools, there is a duty, but not relating to physical features. That's deemed as part of their planning duty. Yet for higher and further education, that does include the material alteration of physical features. And in both those instances is anticipatory. Housing, again, I like to look at the whole life design of a house. I think that's something coming in more and more. Make sure that something that hasn't been a barrier, perhaps when somebody in their 20s buys a house, doesn't become a barrier to the person later on. Landlords and those who have the right to dispose of premises mustn't discriminate when letting or selling. Again, tenants can ask landlords for consent to make alterations. This even applies to the disabled facilities grants process as well. And landlords shouldn't withhold reasonable consent. Transport providers also have a duty. So again, we could often be working for railways, bus companies, all sorts, with whatever we're doing on building projects. They have a duty to provide an accessible service and make reasonable adjustments. And again, that would include level platforms, accessible toilets, just making the whole experience of accessing that public transport as accessible as possible. So everything we do in our own businesses and everybody we're working for will likely have some sort of duty under the Act, and we need to be aware of that and be proactively thinking about that all the time. So what is an inclusive environment? An inclusive environment, I like to think, is well designed, functional, effective, sustainable, and delivers an enhanced user experience. The Construction Industry Council have put together a couple of excellent documents. I know in the first document in 2017, CABE have signed up to the 6 principles. This that's shown here is actually the second of the documents. And it's really useful, and it lays out lots of structure and strategy as to how we can constantly just become second nature to think about being an accessible environment. So an accessible, inclusive environment can be accessed and used safely, easily, and with dignity by everybody. It recognises and accommodates differences in the way people use buildings. Dignity is a big thing, using it in a dignified, equal, and intuitive way so that it becomes possible for all of us to access the space. An inclusive environment readily accommodates and welcomes diverse user needs from childhood right through to adulthood to old age, across all abilities, disabilities, embracing every background, gender, sexual orientation, ethnicity, and culture. As I've said, it's also functional and efficient. And I firmly believe that the more we include early on in our designs, inclusive and accessible spaces can be beautiful. It doesn't need to be, oh, a sacrifice because I've had to make that accessible. It can look stunning. So really the principles are that we place the people at the heart of the design process. Whenever we're designing, we think about the people that are going to use that space. We embrace and acknowledge that we're all different and diverse. And offer a choice where a single solution can't accommodate everything. Be quite flexible in the way we think about it. and create an environment that's convenient for everybody to use. People with impairments don't want to be excluded from the mainstream. They want the same experience as everybody else. It's not about, I always say, it's not about them and us, it's about all of us. So implementing, when we've talked about all the legislation, why we want to do it, why we have to do it. So this is sort of moving on now to talk about how we can implement. Again, I've drawn these 6 principles for creating an inclusive environment from the document we've just looked at. So we've got 6 principles here that I think are excellent for us all to adhere to. And if you've not had a look through the 2 documents, again, they were mentioned, or elements of the first document were mentioned by Julie Fleck in the last CABE magazine. So I think really have a look through and adopt these approaches, because it really is an excellent ethos to be working to. So we've got 1 here: champion and commit to achieving an accessible and inclusive environment. So as the client, developer or contractor, essentially we're saying you have the power and the authority to set an inclusive culture in your organisation. Perhaps identify, there's lots of recommendations for nominating or identifying an inclusive environment champion. And that person doesn't need to be a specialist, they just need to be proactive and committed at procurement stage, through the design, utilise the planning process, push the boundaries, celebrate success, really sort of champion that within your work world. We look at number 2 in your project brief: set out the tools and mechanisms you'll use to create an inclusive environment. I think it's an effective way of looking at the principles of inclusive design are applied from it's really important we do this from the outset. And again, looking at the REBA stages of work, incorporating inclusive design strategy right in at the early stages. Bringing this into the initial design stages saves an awful lot of time and money. Doing this as a reactive matter later on down the line can be very expensive, and also can make spaces look like it was reactive. So you don't want something to look like an afterthought. Set it out in your brief, be very clear with your suppliers as well what you're trying to achieve. There is a code of the British standards in their code of practice set out an inclusive design strategy, and I'm going to show that on the next slide. And this is where this document and the British standard link together, and there's an excellent strategy there that you can follow when you're working to create an inclusive environment. Number 3, structure your budget. It doesn't need to increase costs. Being inclusive really doesn't need to increase costs. If it's planned and integrated into the business case from the outset, you can make it cost neutral. Redesign, as I've said, redesign and post-completion retrofitting can be very, very expensive, and it can also lead to compromises that needn't have been made. Point 4 on here, addressing inclusive design principles, a requirement of your procurement process. I think this is interesting. Whenever I've done procurement and tender processes before, I tend to always build in a quality element as well as just the price element. There's 2 elements to this. You can build it into a quality portion, but also, again, it's important when you're doing accessible designs, sometimes the materials you will use or specialist equipment you will use might be slightly different. And if you procure that correctly, that all has a knock-on effect on the budget and making sure that costs aren't increased. You need to provide good, clear information about what you want to achieve right in the outset of the project, and talk to your suppliers and make them know how important accessibility and inclusive design priorities are. So number 5, the use access and inclusive design expertise. This feels like a sell, it isn't. I'm an access auditor, and I also do design appraisals. I work with a local planning consultant. Sometimes increasing inclusive environment knowledge and skills of all of us in the built environment, all of us professionals, is important, but we can't all be experts. And I think knowing what you don't know is important. So sometimes if it's a large project, there's absolutely right at the beginning, if you're going to get an access consultant on board, do it right at the beginning of the design stage. There's nothing more frustrating than looking at plans that have been drawn up and you're coming in several stages down the line. It's very frustrating then to try and implement change. So if you are going to consult an expert, get them involved early on. Monitor and appraise the outcomes of your approach, and this is really important. Look at what you've achieved when you get to the end of a project. What's worked well, what hasn't, what can you utilize on other projects, what wouldn't you do again? Even go back, talk to the end user groups. And I always think this is really important as well. If you get at brief stage, get a really good relationship with the client, because then when the project is finished, and this comes onto my list of things that I sort of think to myself when I'm doing things to consider and remember, determine the brief with the client is really important because it all ties in with the end stages as well. So being able to talk with them afterwards, what's worked, what hasn't, what should we do again, what shouldn't. Planning and access statements again. Make sure very early on that you're employing consultation, identifying any issues. Think about your REBA plan of work. If you're having a consultant, where are you going to get involved? When are you going to start to cost up anything specific to the inclusive environment you're creating? Don't forget that just because you're doing what you're doing, your consents are still required. You still obviously need your planning, your building control, third parties, landlord's consent if it's a lease or communal area. An interesting point, the Act does not make unlawful anything done to comply with other legislation. So your health and safety issues like your means of escape have to come first. There can't be compromise on key health and safety issues to make somewhere accessible. There are no Equality Act standards. There is no document that tells you if you do this, you meet with the Equality Act. It's about access to services and facilities, not buildings. And I've done access audits where people will say to me, oh, does my building now comply with the Equality Act? No, buildings cannot comply with the Equality Act. You're allowing access to, as I've said, the service or the facility in an accessible way that reduces the risk of mitigation or that person feeling discriminated. The building itself cannot comply with the Act. Again, the means of avoiding a physical feature must be reasonable. So if you see a problem, go off on a massive design idea that costs a fortune, always think, is this reasonable? Look at the size of the business, what's going to be gained. You need to achieve a standard of access for disabled people equal to that enjoyed by the rest of the public. Think of the whole life cost of your design, sustainable homes, aging population, and work to best practice. No one can argue if you work to the best practice standards, that's a reasonable approach. So those are things I always remember. It's worth looking at the document we discussed. This is the strategic vision. So try and work with strategy. It talks about the initial concept of the brief, budget estimate, procurement. I'm not going to go into this into too much detail because we've discussed it on other slides, but there's the strategy there, and it's a really good reference point when you're working to design accessible spaces or do anything within that process. You may not be designing it, you may be enforcing regulations, so many roles within that, but this strategy is very useful. So the physical features that we talk about when we say physical alteration, we perhaps look to remove, alter and avoid. I always think about that in my head, and I think about a public building where we had a listed frontage. There was a very striking door with a massive set of steps leading up to it. We couldn't do anything. That was the main access point to the building. There was nothing we could really do to remove it because we weren't allowed to, and neither would we want to. We couldn't alter it. Structurally, we couldn't make the door opening any wider. With the consents that were required, it would have been too expensive, too challenging to alter, to do anything. I said there was quite a steep set of steps. But avoid. Now, as we looked at this building, there was a side entrance that did have level access. Came into quite an open space where a reception desk could have been put with a little bit of tweaking. So in that instance, we left the feature there, the main door, because we were required to, and it fulfilled the whole character of the building. But what we did was alter the way the building was used. So we then made the side entrance, which was level access, the main entrance for everybody. And I think that's the key thing with physical features. Don't just make a an accessible entrance, but then everybody else still goes through that front door. it's better if you can make one access for everyone, because you're coming back to that equal opportunity. So we could go through this forever. There's so many physical features. When we look at a building, from design, from audit, from anything with accessibility, we look at parking and pedestrian access. How do you get from your car to the building? How do you get off public transport? Is there wayfinding? Do you know where the door is? Can you get in the door? Entrances and reception areas. If you were in a wheelchair, is there a drop counter? If you had a hearing impairment, is there a hearing loop? Can you be heard at reception? Vertical and horizontal circulation, we talk about stairs, lifts. Colour and tonal contrast is very important for visually impaired, but it's also very important for people with cognitive impairments. I find with lots of museums and galleries, everything's white, the walls, the floor, the ceiling. And if you walk in there with some sensory impairments, you can't place yourself in that space. You don't know where the floor ends and the wall starts. And sometimes it's as much about tonal contrast as it is about colour. Sanitary provision, obviously there's guidance within DocM, accessible WCs, the sizes they should be. We're now looking a little bit more as well at gender neutral sanitary provision. Wayfinding and signage, looking at where it is it clear? Is the font clear? Does it colour contrast with the background? And I find with wayfinding and signage as well, colour and lighting is really useful in large buildings to denote what floor you're on or where you are within the building. Acoustics, again, people with sensory impairments, noisy cafes, hard floors, no soft furnishings, hard furniture can create an environment that they find incredibly stressful. Switches and controls, are they at the right height? Again, lighting schemes, your means of escape, something that often, where are we putting refuges, what means of escape? It links in with your policies and procedures. If you've got evac chairs, if you've got somebody in your building with a wheelchair, how are you getting them out? All needs designing in early on, and any assistive technology that you want to include within that building. So when we talk about physical features, whether it's a refurbishment stage, following an audit, making improvements, or at initial design stage, there's so many. Gone are the days where I say that, I think that mental attitude that, oh, we've got wide doors and a ramp. There's so many other factors, and these factors are driven by design guidance and enforcement measures. Some of these are just guidance, some must be adhered to. So as we've talked before about the building regulations, whenever you're doing design, approved document M looks at your means of escape. Approved document B looks at fire, means of escape. Guidance can be sought there for the refuges, not specific to accessibility, you know, or designing for people with disability, but it's got to be adhered to. And as we've said before, being inclusive and accessible can't override other documents that relate to health and safety matters such as fire. Approved document M looks at your access to and use of buildings, broken down into sections. So access to buildings initially from the car park, doors and lobbies, section 3 for your horizontal and vertical circulation. It looks at your facilities within a building, sleep facilities are covered, if you've got auditoriums, refreshment areas, everything, the guidance is there for you that must be adhered to. Document K looks at stairs and ramps, again within the physical environment. We need to look at, particularly people with visual impairment, make sure you've got your contrasting nosings. Lots of people like to put these glass balustrades in, I'm finding at the moment, and then with no manifestations on. So if you're going up the stairs with a visual impairment, it looks like you're just going to drop off the edge. So there's lots of things that need to be thought about with stairs and ramps. The British standard is guidance. It's a document there. It bulks out what you've got in the building regulations. There's an awful lot of detail there, and it covers lighting recommendations. Really, it's an industry approved document that's really useful. The first one of them, external environment, it's a code of practice, and the other one relates to buildings, a code of practice. There are certain instances I have found where there are some anomalies, and there's things in the building regs and things in the British standards that differ slightly, which can sometimes be useful if it's you know, you think, oh gosh, I can't quite meet with that, but I can meet with that. But as a rule, if you work use them as a really handy guide. There's the Centre for Accessible Environments and REBA together have done a Designing for Accessibility document. Again, it's just got lots of really useful size sketches, detailed information about how you can make spaces accessible. It's a really handy document, and loads of design guides for industries. Sports England have one. I think on here we've got the Museum and Galleries, the Arts Council have brought one out. There's the Good Loo guide. There's loads of supporting documents to support you, whether it's at refurb stage or at new stage. And again, don't be scared to employ an access consultant. If you feel actually this is beyond me, design appraisals, audits, get a specialist involved. So you and your business, not just actually working with people and other organisations, your own business. If you have premises, think about the things we've discussed. Can you make your premises physically more accessible? Maybe within your company, nominate a champion, somebody that's going to look at all aspects of your business and really plug away at making it more inclusive. Have a think about how you offer your services. When you go to do visits, when people are visiting your office, how do you present your reports and information, general information about your business? If you've got downloadable flyers or anything on a website, have you got easy read versions of those? Do you have any audible support on your website for people that can only partially see it? Or you can often signpost to a piece of technology that can support with that. Ensuring, as I say, that your website is accessible. Provide training to your staff and promote an inclusive business culture. Make sure everyone's aware of what their obligations are, and that you keep plugging away, keep making sure that people are thinking about creating these inclusive environments. If you do employ staff with impairments, then think about how you can make it a more suitable working space for them. Maybe offer some flexible working, provide an instruction manual generally for business, terms and conditions, perhaps in an easy read format. Maybe arrange for meetings to be held at a location or time to suit them if they have specific needs. Certain people are very routine driven with certain conditions. And maybe think about giving them more time to complete a task. Think about workload and how that's impacting on them being able to sustain that position. So there's lots we can do within our own businesses as well to make sure that we're being more inclusive. Positive attitude and innovation. So we all want to contribute to raise awareness of the issues surrounding accessibility. So this isn't perhaps just about the physical side of doing our day job. I think we all need to just have a really good, positive environment and encourage everybody else to get involved. And this is where we've discussed previously. In 2016, CAVE signed up to Construction Industry Council Essential Principles for the Built Environment Professionals. So that is to contribute to building inclusive society, apply professional and reasonable judgment, integrate the principles of inclusive design from the outset. Don't just comply with the legislation. Just think outside the box and push that extra mile. Seek multiple views, share your ideas, and then acquire the skills and knowledge. We've talked about this. Keep yourself up to date with new legislation and new products and different innovations that can help in your quest to to promote these inclusive environments. So what if it goes wrong and what if we don't? Costly corrections and retrofits, and I've put here the make do. I often think if we don't get this right at the beginning, it can be very difficult and very expensive to put it right further down the line of a project, and certain aspects will always lead to compromise and inefficiencies, and probably will always look like an add-on. So if we can get it right from the start, then learn from previous projects, that will save us time and money. As we've discussed, the Act prohibits people feeling harassed, victimised or discriminated. The Act isn't policed as such. Obviously, we've got building control and planning, which are regulations that we need to meet, and there's an enforcement element to that within building and refurbishment. There's civil rights legislation activated by the individual. So somebody that felt they'd been discriminated against, harassed or victimised can bring a claim. There's employment tribunals if it's somebody you employ. And as I've discussed before, there's the negative publicity and poor reputation. If your personal business or project you've been involved with later goes on to receive negative publicity and negative press. So I've just put a slide here, and it's something from the document that we've discussed, but it's interesting. The annual spend of 150 billion, and the government's planning to increase infrastructure. There's a huge opportunity here for us to no longer disadvantage disabled people in the way we design. It's not just a legal or moral or social issue. The business case is clear, as we've discussed. There's over 13 million disabled people with huge household income. There's the family, friends, carers. The number of people by poor design, affected by poor design, can be substantial. There's an increasing number of older people wanting to continue to live active and independent lives. And the time is right to change our attitude. I firmly believe, and I'm so passionate about this, that we can make huge, significant changes. If we want to live in a fair and equal society, inclusive design benefits everybody. And as I like to hope I've made quite clear, you can play a huge part in that. Thank you very much for taking the time to listen to my webinar. My details are on here. If you want any further information or want any surveying or access consultancy services, then please feel free to contact me on the means below. Thank you very much.
Thank you very much for that, Sarah. So just having a look at the time, we have had a couple of questions, but I think what I'll do is send them over to you outside of the session. And then we can put together a little question and answer flyer for the attendees, and then I can send it over to them all. So just quick mentions. Hopefully you'll all be aware that CABE have partnered with Fire Risk Consultancy Limited. So this is to provide our members with some online fire safety training. So if that does sound of interest, please go and have a look on our website. The courses will all count as formal CPD in line with the CABE requirements for your membership. And they will provide valuable learning or refresher training on core building safety competence. So please do go have a look on our website for any further information, or you can email the training and events team using the training@cbuildy.com email address. I just want to thank Sarah and everyone for joining us this morning. Just to remind you, it has been recorded, so it will be uploaded to our YouTube channel later on today. If there are any comments that anyone has, any questions or any ideas for future webinars, please do send them through to me. Our next webinar is on Wednesday the 10th of June. So hopefully I will see you all online again next month. So with that, I'll wrap up for today. Thank you very much for joining us. Thank you again to Sarah, and hopefully I'll see everyone online next month.